Welcome to your post-operative care video for Advanced Dermatologic Surgery. Please take a comfortable seat, take a deep breath, and know that you are in excellent hands as you begin your healing process. Today, we're going to gently walk through exactly what you need to know and do to ensure a safe and smooth recovery right at home.
To give you a very clear roadmap of what to expect, we've divided your recovery journey into 5 chronological phases. We'll cover immediate care and bleeding, your daily wound care routine, activity and lifestyle restrictions, medications and pain management, and finally, exactly when to contact us.
Phase 1. Immediate care and bleeding.
So those first few hours after you get home, they're really all about resting. You just want to let your body comfortably start that initial healing process. Now, it is very important to know that bleeding, bruising, color changes, and swelling are completely normal. We expect this for the first 24 to 48 hours. In fact, your bandage might become totally saturated and even leak blood during this time. That is absolutely okay. And if your surgery was on your head or near your eyes, the area might swell significantly. Sometimes your eyes might even swell shut, or your nose could feel stuffy, kind of like there's something inside it. Please, don't be alarmed. This is just your body's natural response, and those symptoms will slowly dissipate and go back to normal within 1 to 2 weeks.
Now, if your bandage does become completely saturated and it's just not absorbing blood anymore, you should go ahead and remove it before you apply pressure. When you do experience bleeding, grab some gauze, a clean paper towel, or a washcloth. You're going to press firmly and directly on the surgical site for a full 30 minutes. And here is the absolutely critical rule. Do not lift your hand to check on the bleeding during that time. You have to keep that pressure steady and continuous. You might even need to repeat this 30-minute process a few times before the bleeding fully stops, and that is perfectly fine.
To help manage any swelling and bruising over those first 48 hours, you can place ice around the surgical area, for example, near your eyes. But please make sure not to place the ice directly on top of the incision itself. Also, when you rest, try not to sleep on the side of your body where the incision is. If your surgery was on your head, just keep your head gently elevated. You can use a few extra pillows or even sleep in a recliner for those first 48 hours. If your incision is on an arm or a leg, you want to keep that limb raised above the level of your heart as much as possible. Oh, and if the surgery was on your arm, be sure to take off any rings or watches, just in case your hand starts to swell a bit.
Phase 2. Daily wound care routine.
For your specific procedure, we are utilizing what's called second intention healing. All that really means is that your wound is being left to heal naturally, right from the inside out, without using any stitches or staples. Because of this, maintaining the exact right environment for the wound is going to be the absolute key to your successful recovery.
When you left our office, you had a large, bulky white bandage made of gauze and tape, or maybe a protective wrap if your surgery was on a limb. This initial bandage actually isn't medically necessary for the healing itself. It's simply there to help contain any bleeding and make your care a little easier. Please leave this bulky bandage securely in place for the first 24 hours. If it happens to fall off before then, don't worry, it's not a problem at all. But after those 24 hours have passed, you can go ahead and remove that bandage, and you are officially welcome to take a shower.
Once that first bandage is off, you'll start your daily routine. Every single day, you'll just follow 3 gentle steps. First, clean the wound with mild soap and water. Second, apply a nice, thick layer of Vaseline to keep the wound moist. And third, cover the area entirely with a clean, non-stick bandage. You'll want to keep the wound covered at all times when you're not actively washing it. The main goal we're aiming for here is consistent moisture. We really do not want a hard, dry scab to form. A moist environment truly gives you the very best outcome for second intention healing.
Now, during this healing phase, it is absolutely vital that you pause your usual skincare routine anywhere near that surgical site. Please do not apply sunscreen, do not apply makeup, and definitely do not use any scar treatments like Silogen. You really need to wait for explicit instructions from our medical team at your next follow-up appointment before you resume any of these products.
Phase 3. Activity and lifestyle restrictions.
Protecting the surgical site from physical stress is honestly just as important as keeping it clean. On the actual day of your surgery, if your procedure was on your face, neck, or scalp, we ask that you stick to a soft, cool diet, try to minimize talking, and just remain as inactive as possible. Doing this greatly reduces your risk of excessive bleeding. Across the board, for the first 24 hours, you must completely avoid alcohol because it can increase bleeding. And one more thing, if the site is on your head or neck, please do not bend over with your head below the level of your heart.
Then, for a full week following your surgery, your lifestyle just needs to stay very relaxed. Do not lift anything over 10 pounds. Skip the workouts. Do not exercise or do any physical activity that causes you to sweat or honestly anything that raises your blood pressure. Keeping your body calm and rested ensures that the delicate new healing tissue isn't disturbed prematurely.
Phase 4, medications and pain management.
Making sure you stay deeply comfortable at home is a big priority for us, and there are very safe, reliable ways to manage your pain. For relief, you can absolutely rely on over-the-counter medications. You can take 2 extra-strength Tylenol, which is acetaminophen, and/or 1 to 2 ibuprofen, like Advil or Motrin. Just be sure to follow the directions printed right there on the bottle. Unless you have a specific medical condition that prevents you from doing so, you can safely take these 2 medications together every 6 hours. It's a really easy way to manage your comfort.
Now, if one of our nurses discussed an antibiotic with you today, please make sure to pick it up from your pharmacy and take it exactly as directed. A quick reminder, always take it with food to prevent an upset stomach. If you do happen to experience any side effects or an allergic reaction to the antibiotic, just don't take your next dose and call our office right away for further instructions. Aside from that, you are fully cleared to resume all of your usual daily medications, both over-the-counter and your normal prescriptions. If you stop taking anything before the surgery, it is entirely safe to start taking it again right now.
Phase 5, when to contact us.
We are always here for you, but there are some specific signs you should actively monitor for at home. There are a couple of situations where you should definitely contact us immediately. First, if you develop strong itching with bright redness around the area. This usually just means you're a bit sensitive or allergic to the bandage tape. If that happens, simply take the bandage off and call our office for further instructions. Second, you should absolutely call us if you experience bleeding that just won't stop, even after you've made several back-to-back attempts of applying that firm, direct pressure for 30 full minutes.
You should also be highly aware of the signs of infection. Now, these typically don't appear immediately. They usually show up between days 3 and 7 of your recovery. Watch closely for a fever over 100.4 degrees Fahrenheit, or if you get the chills. Keep an eye out for spreading redness, sudden warmth around the site, severe swelling, or any thick yellow or green drainage. Also, if your pain worsens after day 3, or if it suddenly gets worse after it was initially improving, please reach out to us right away.
If you have any questions at all during your recovery, please contact our office.